single, married, divorced, widowed?
Oh, single.
And do you currently work?
No, ma'am, I'm retired.
Is your primary care Callie Linden?
Yes, ma'am. One second. There's been some issues with that, but I'm still working on it with Aetna, I guess. She's still covered and is supposedly still my primary care, but there's been issues with the hospital, I guess. They've been like they like discharged me out of nowhere.
Okay.
I'm not sure why. Like at all. I received like emails and stuff from what apparently was a spam provider, but like through their email itself, like to where it looked official, you know, like through LCMC and things. But when I had spoken to LSU about it, because I also received, I guess, spam from them, they just said I had to disregard it. So I don't think that was necessarily connected, but they're maybe having problems or something with their clinic, and I can't really like reschedule appointments with them. They canceled a bunch of my appointments and stuff like that.
Okay.
So but I think for now, I probably am still with her as my primary care because Aetna didn't want to change it.
Have you seen her in the last 12 months?
Yes, ma'am.
Okay. And
so that's all that matters is like within a year.
Yeah.
So like if next year I still haven't been able to see her, then I have to change.
Probably. Yeah.
Okay.
You have your medication?
Yes, ma'am. I just brought them in this little box. Allergy, vitamins, epilepsy, gastroenterology, and then the rest of my neurology medicine.
All of these are just the same. Well, nothing's in there. These three. Nothing's in those two. I have them all.
Oh, yes, ma'am. They're just, I take 3 doses.
Do you have any allergies to any food or drugs?
Yes, ma'am. Latex and, like milk protein, lactose.
Okay.
Or both. Depending on how specific it's listed.
Have you been checked for diabetes in the last 12 months?
No. Should I do
At least
that?
once a year. But they'll do it on your annual blood work.
They haven't been wanting to do annual blood work. I don't know if maybe that's been a problem, but they've been trying to, like, not do that. So should I just, like, request annual blood work from my primary care? Because every time I did, because I usually would have my annual blood work for my cancer, or more than once a year, actually, much more intensive than normal annual blood work, and everybody just kind of didn't want to do it.
So if you were getting blood work anywhere else, then maybe they had access to those and they can see the things that was needed to be seen then. I don't know when you were getting your blood work, what was being ordered.
I doubt that. I was getting some blood work for specifically this, but it was only to test my liver. I don't know if a liver would test like the glucose blood level.
No.
Yeah, I didn't think so. And so I need to request something that's specific to diabetes per annual.
But that would be in a CMP. So if they order a CMP, it
So
gives.
it's called a CMP.
Yeah, it gives like liver enzymes, kidney enzymes, potassium, electrolytes, all of that. Have you been to the emergency room in the last year?
No, ma'am.
Family history, mom, dad, any illnesses or diseases?
My father has Alzheimer's dementia, and was pre-diabetic. He probably is almost diabetic now, maybe not. I'm not sure. It had to do partially with his Alzheimer's and his potential treatment for that, but I don't know if they've started it yet. I think it probably has by now, but so yeah, maybe I definitely should have the diabetes testing. My mother, nothing. Maternal grandmother had only uterine cancer, genetic. So they test my mother for that and stuff. But that wouldn't apply to me, so that wouldn't matter. But that's the only. They've done all of the cancer testing for genetics for me because of my cancer.
What type of cancer?
Stage 4 malignant melanoma.
Okay.
So because of the terminal status and the unique mutation for me, to get it at all as a childhood cancer, I have the whole family history for specifically oncology, but I've never actually looked into stuff like more normal things that could be screened. I didn't think about diabetes before. I just kind of assumed it wasn't going to be an issue.
Have you had your flu shot?
I think I did on last time I saw my primary care in November.
Okay.
But I'm not sure. They gave me I think they gave me a vaccine, but I don't know if it was a flu shot or the hepatitis vaccine, because they were going to give me both that day, and I'm not sure if they just had it in one vial or not, or if they gave me 2 shots and I just didn't know.
Okay.
I frequently am going to have seizures and am going to be asleep because of my narcolepsy, so unless I'm on the stimulant, I'm not going to be awake, and I could still be having some seizure symptoms, and I don't know how I was feeling that day at that point, so I just don't remember.
Okay. Have you had the tetanus in the last 10 years? Vaccine.
2015, I think.
Okay.
Maybe 2014. Do I need that again?
Every 10 years.
Okay. So the CMP blood test is to be ordered annually for diabetes and other screening. Diabetes mellitus or just okay.
It's type 2. Yes, it screens for type 2.
Mellitus type 2. Okay, so that's for that, and then the what were we just talking about? It was
the tetanus.
The tetanus. I need the tetanus.
Have you seen an eye doctor in the last 12 months?
I was seeing them, but they were one of the ones that just discharged me out of nowhere from UMC and stuff. But I wasn't seeing them for normal eye doctor stuff. I was seeing them for cancer. They screened for melanoma in my eyes because that's where it spreads first in the brain. Since I still have active melanoma, it would be there, and so it's like an early screening thing. So I don't know if I was seeing a normal optometrist.
Okay. Do you smoke cigarettes?
No, never.
Any shortness of breath, wheezing, or coughing?
No, not that I've seen.
Have you ever had a heart attack?
Nope. I have had one interaction from medication that was because of gluconephrin and heavy exercise outside, the heat, and other medications and the stimulant at the same time. But besides that, I've never felt anything.
Do you ever have any constipation or acid reflux? Okay.
Did I bring down the other medication? I do have like cancer-related gastric problems, and that's what that is. But
do you get dizzy when you stand up?
Oh, every once in a while I get constipated, and I have another prescription for that, but I use it so rarely that I didn't have it out of the into the box.
Any stroke or seizure?
Yes, yeah, I have seizures all the time. Yeah.
Okay. Yeah.
That's what the I got
acid.
See.
When was your last seizure?
My last grand mal seizure, or just seizure in general?
A seizure in general.
I couldn't tell you really.
Okay.
My last grand mal seizure was like a month or two ago, maybe. Maybe in December, maybe in January. I don't remember. Probably January when it snowed like around here and stuff. I probably, yeah.
Do you drink alcohol?
Never. I can't with the epilepsy medication.
In the last 2 weeks, have you felt down, depressed, or hopeless?
No.
Issues with sleeping?
No, that's a kind of no. I don't.
Any thoughts about harming yourself?
No, never.
And you never had hip replacement surgery, right?
I've had extensive oncology-related surgery around that area, yeah. And I had all of my lymph nodes through my groin removed because of the cancer, all my sentinel lymph nodes. And so it but no full replacement.
Right now, are you currently on treatment for the melanoma?
The treatment is like an infusion period, and then it's a subcutaneous infusion period, and then you just get pulled off of it whenever you have too many neurological problems, which is where I probably had epilepsy beforehand, but maybe my epilepsy had like more of a presentation. I definitely didn't have narcolepsy beforehand, but once those symptoms started happening, and I had 2 frequent tonic-clonic seizures to where I was like not able to talk and stuff like that. Then they cessated the treatment, and that was in 2008. And the treatment basically works until the cancer overpowers the treatment, and then you go on another regimen of treatment, and you just keep doing that.
Okay.
So technically, yeah, I'm still on chemotherapy, but it's not like I'm not on a new infusion. That's just how melanoma works.
I'm gonna get your blood pressure. Oh, sorry. Temperature 97.9, and that's for your oxygen level. (112/76) is your blood pressure. Pulse of 103. Let me put that in. You don't wear hearing aids, right?
Do I need them?
Wear hearing aids.
No,
I'm asking.
No, do I wear them? Oh,
yes.
No. I mean, I wear headphones all the time, yeah, for noise, for sensitivity to that, for neurological problems, but
not that you cannot hear.
No, not to help me hear.
Right.
The opposite, basically. To dampen sound.
99% on room air. And stand up for me. I'm going to get one standing. 118 over 87 and 110 post. How tall are you?
Oh, sorry, I'm wearing boots. 5'7", like 5'5" or so.
And how much do you weigh?
I probably lost a little bit of weight, but last time I was weighed at oncology last month, it was 114, I think.
Any problems with swallowing or eating?
No, ma'am.
110. Take a listen to your heart. You can sit. That's fine. Deep breath in and out. You can breathe normally. Lungs were clear, regular heart rate and rhythm. I'm just going through your diagnosis and we're almost done.
So you guys have in there that I have epilepsy, you have the narcolepsy.
Yep, I just went through that.
Okay. And the cancer.
Mm-hmm.
Okay. What else did I put in there? Intractable neuropathy.
They have neuropathy.
Okay, they have neuropathy. Cluster migraine headaches.
Mm-hmm.
Okay, just making sure.
They have that you are eligible for a $50 gift card, and they will send a packet in the mail on how you can get that reward. Okay, just for doing this assessment.
Okay, great. So I should just expect that in a couple of weeks or something?
Alright, I just need signatures from you. And then we'll be complete.
Do you guys have my correct contact information for like this address and stuff?
Well, yeah, it's in the system.
Okay, I just wanted to make sure because I updated my Medicaid information and stuff in December, and Edna said they got that, but I just wanted to make sure Signify had that too.
Yeah.
Which would be this address, and then it was like my phone number and stuff got changed. Well, my phone number didn't, but the address changed and all that.
And that's it.
That's
okay.
it?
Yeah.
Okay, thank you.
Thank you for your time today.